morning, everyone. My name is Lisa Wright, and I'm a senior at Temple University, engaging in the pre-health and pre-occupational therapy track. Today, I'll be talking to you about the dangers of elderly driving and a way to promote safety and prevention of deaths and injuries in the elderly population. The National Highway Traffic Safety Administration states that senior drivers account for 14% of all traffic fatalities and 17% of all pedestrian fatalities. Fatality rates for drivers begin to climb around the age of 65. From ages 75 to 84, the rate of about 3 deaths per 100 million miles is equal to the death rate of that of teenage drivers. For drivers 85 and older, the fatality rate skyrockets to nearly 4 times higher than that of teens. Also, aging causes medical problems that can affect driving, such as a decrease in eyesight, reflexes, memory, reaction times, motor skills, and flexibility. People around age 55 take about 8 times longer to regain normal vision after exposure to bright light than someone who is 16. An elderly person may have trouble distinguishing red lights from yellow lights or braking lights from running lights. Also, seniors may suffer from vision disorders such as cataracts. There is approximately a 2% increase in brake reaction times for every 5 years, starting from the age 15 and ending with individuals aged 75 and older. Also, over 80% of people 65 and older take at least one prescription medication daily. Some of the most common medications, such as antidepressants and antihistamines, have a potential to reduce one's ability to drive safely. Lastly, the U.S. Census Bureau projects that there will be 9.6 million people age 85 and older by 2030, which is a 73% increase from today. Road safety analysts predict that by 2030, when all baby boomers are at least age 65 and older, they will be responsible for 25% of all fatal crashes. And now I will present my solution. With the concern on the rise of elderly drivers age 65 and older on the road and the statistics shown on their decreased driving abilities, I believe a law needs to be passed in order to prevent future injuries and deaths from occurring in the elderly population. Pennsylvania is the only state that has a physician's reporting law, which requires physicians to report disabilities that could affect a person's driving abilities from ages 15 and older. This law does not enforce penalties for physicians that do not report patients' disabilities. Since this issue concerns the Pennsylvania Department of Transportation, I would have them help create another bill to pass a law called the Physician's Reporting Law 2. This law would enforce all states in the U.S. to require physicians, physician assistants, certified nurses, chiropractors, physical therapists, occupational therapists, and optometrists to report all their patients' disabilities that have a licensed driver that are over the age of 65. These reports would be sent out 10 days after each patient's checkup. These healthcare professionals will be required to report psychomotor, visual, and cognitive deficiencies, diseases such as Alzheimer's and diabetes, what medications the patient is on, and if these medications can affect the patient's ability to drive safely. Also, in the report, the healthcare professionals will have to include a yes or no answer with a reasoning of why they think the patient is or is not able to drive safely. The health professionals will also be required to inform their patient if medications prescribed or disabilities diagnosed can affect the patient's driving ability. Each state will have a medical advisory board that reviews these medical reports confidentially. If the doctor reports that they do not think the patient should be driving, and the medical advisory board agrees, the patient will have to take a screening and driving test at the DMV to test the person's cognitive, psychomotor, and driving ability. Furthermore, if healthcare professionals fail to report this information and their patient is in 2 or more accidents within less than a year, the healthcare professional will be fined $1,500. This bill will then be sent to the National Transportation Safety Board to be reviewed by them and improved to fit other states' ideas. It will then be sent to the House of Representatives to be reviewed and hopefully passed as a nationwide law. In conclusion, I am going to be an occupational therapist, and I believe that The Physicians Reporting Law 2 is one way to help prevent injury and death in the elderly population and make roads safer. Thank you for your time and consideration. Any questions?